Good afternoon, everyone. My name is Tabassum Ali. I am a first year student in University of Fiji, and I am currently doing Bachelor of Public Health and Primary Health Care. My co-partner is Olinda Tane. She also is a first year student in the University of Fiji, also pursuing Bachelor of Public Health, the Public Health and Primary Health Care. Unfortunately, she could not join us today for personal commitment. Without further wasting our time, let me continue with my presentation for today. I am sharing my screen. Our topic today is the 21st century's social epidemiology in Fiji, the social determinants of health, its impact and implications in public health status of the active population. Social epidemiology is the subfield of epidemiology that studies the effects of structural, social structural factors on health outcomes. The Ministry of Health in Fiji incorporated the concept of epidemiology, which gave rise to social epidemiology, which is the identification of social elements that influence the pattern of diseases and health distribution in the society, as well as the knowledge of its mechanisms. The impact of these social determinants on the health of the active populations, Fijian active populations rather, the public health status in order to develop conclusions about processes that could be relevant in other Fijian populations and situations. The statement of the problem. This 21st century's social epidemiology in Fiji needs to be revised, monitored and reorganized towards the public health status, taking note on its impacts and implications amongst the active population. If the epidemiology practitioners continue to be mechanical and ritualistic in their studies and practices, as is currently the case, then they are insensitive to the context of the social health determinants and will not proceed in produce rather improve public health outcomes for these active populations. The objectives of the study was number one, to describe what should be aware of when it comes to social determinants of health in today's world. Number two, to find out the current social determinants of health present in Fijian environments. Number three, to describe how guidance and information about social determinants of health were put into circulation and practice in Fijian communities. Number four, to figure out where these health promotions should be distributed. Five, to figure out when these health promotions should be given out. And six, to evaluate how the existing social determinants of health has impacted the active population of Fiji. The scope of study. This research paper is mainly focused on the 21st century's social epidemiology. It is based in the Republic of the Fiji Islands, and it is mostly focused onto the active population. They are defined as people between the ages of 15 to 64. These are individuals comprising of both employed and unemployed citizens. The limitations of the study. First, the small number of cases given to study limits the quality of this research. Secondly, because of the information is mainly retrieved from the internet due to the COVID-19 restrictions present in Fiji, there is not adequate data and statistics provided. The research design. Sources of data. All data was acquired via internet, specifically through peer-reviewed scholarly literature found in Google Scholar, PubMed, PsycIn, Medline, and from WHO statistics and publications, the Ministry of Health and Medical Services in Fiji, and peer-reviewed journals. Peer-reviewed journals, rather. The methodology. This was a descriptive research project. This study was classed as a category of research based on the topic's importance. This study was on what may be learned from secondary research studies. The study was carried out by constantly engaging with their experiences and exposures in order to uncover themes and insights that could shed light on the social determinants that exist in Fiji among the active population mainly, and the difficulties that they face. The main findings: the the socio-economic determinants of health have a significant influence in the establishment of long-term healthcare systems in most of the Pacific, including Fiji. The health determinants found to affect the study population were: firstly, poverty. According to a Fiji Village report based on the Household Income and Expenditure Survey, 258,000 people in Fiji were living at the basic needs poverty line in 2019 and 2020, were living below the basic poverty. And this is the statistics that was taken. This is the graphical representation of the percentage of population that were living below the poverty line. Moving on, we have food insecurities. Over 250,000 people are projected to be living in poverty and hunger among the city's 926,276 residents. Unemployment. Fiji's unemployment rate grew to 4.8% in 2020 from 4.2% in 2019. According to the Trading Economics, the unemployment rate has risen significantly in the 21st century, particularly during the COVID-19 pandemic. And figure 2 is the graphical representation of the unemployment rate from 2019 to 2020. As we can see, the fluctuation in this data. Moving on, we have stress. According to the World Health Organization, it was found that more than 30,000 people in Fiji suffer from depression. Figure 3 shows the teenage suicide rate from 2005 to 2016. Moreover, we have education. Despite the fact that education in Fiji is free, students continue to drop out. In 2019, there were 794 dropouts, with the largest rates of dropouts among high school students. Moving on, the healthcare providers and availability. In many circumstances, Fijians in rural communities must travel for hours to receive treatment. 16 subdivisional hospitals, 78 health centers, 101 nursing stations provide public health services. Fiji had 134 doctors and 187 nurses as of 2018, according to the Fiji Sun. However, in January 2019, according to FBC News, there were 815 doctors. This was a major rise, noted. The impacts of these determinants include mortality rate, the life expectancy rate, and the healthcare expenditures. To conclude, today's social determinants of health are social, cultural, and environmental elements affecting the health, well-being, and the quality of life of Fiji's active population, including poverty, food insecurity, unemployment, stress, education, and the healthcare provision and availability mentioned above. The consequences of current social determinants of health in Fiji include increasing adult maternal mortality rates and the decreasing life expectancy. Recommendation. As suggestions, I would recommend to firstly monitor the social health factors on a regular basis to reduce exposures and their effects on the active population as well as the general population. Ensure that the minimum wage is increased in order to combat poverty. Develop health promotions targeted specifically at the active population, including discussions with them about the existing socio-economic determinants of health and the development of a strategic plan to address this issue. Cutting down on food waste. Create a home-based business for folks who are having difficulty finding work. Next, I recommend to provide transportation to the most remote of places so that proper public and medical services may be accessed. And finally, living a healthy lifestyle where regular exercise can assist to reduce stress levels. I respectfully wish to offer my heartfelt gratitude to the people listed below whose encouragement and support have helped me to successfully complete this academic challenge. To the Lord and Savior, Jesus Christ, our God, our only source of life, wisdom, knowledge, and insight, as well as spiritual guidance. To our parents and siblings for their unwavering support. Miss Olinda, my colleague and my friend, with whom I have worked on this project proposal, thanking her for her endless help and for her friendship. To Mr. Ravindra Prajapati, my educator in public health, learning and promotion, for constantly encouraging us in our learning experience and for bearing with us through this academic difficulty. And finally, to the organizers and audience for creating such a platform and for offering everyone the opportunity to present their findings and research. These are my references. Ladies and gentlemen, the impact of this study, this 21st century social epidemiology in Fiji needs to be revised, monitored, and reorganized towards the public health status, taking note on its impacts and implications among the active population. If the epidemiology practitioners continue to be mechanical and ritualistic in their studies and practices, as is currently the case, then they are insensitive to the context of the social health determinants and will not produce improved public health outcomes for the active population. Skills and information might be used by social epidemiologists to assist public health practitioners in strengthening and improving the health of Fijians. As a result, a more integrated and suitable public health status will emerge and health outcomes for Fijians will improve. Live with intention, walk to the edge, listen hard, practice wellness, play with abandon, laugh, choose with no regret, appreciate others, continue to learn, do what you love, live as if this is all there is, as said by Mary Ann Rednacher. to thank you all for your time. Pinakabakalagi.